Okay, so rods are the back of the eye. Good. That's all there is. Cones, thinner. They do color. They respond to different wavelength. There's the red orange one. So the blue wavelength is the one that the blue cone cells do. Blue. Simple as that. Blue wavelength, blue cone cells. If there's a green cone, then it will do blue yellow light. If it's a red cone, it will do orange yellow reddish light. Okay. So it will respond to the highest stimuli at that wavelength. So the wavelength, if it's blue wavelength, the blue cones will respond to the highest stimulus. Okay. They will have the action potential frequency increase with the right stimulus. Good. And blue and yellow together make green. That's what they're called, green cones. In case. Hearing and balance. Yeah. Hearing, and then you're joking. Hearing, we already did hearing a little bit before. So this is just a hair cell part of it. Hair cells, how they're special is that they have cilia at the end, stereocilia and kinocilia. Kinocilia are really tall ones. Stereocilia are the tiny grouped ones. So what will happen is when you have a sound wave come in, it will propagate that. It will move the liquid, right? And as it moves the liquid, it will push the hair cells down. So when it pushes them down, what happens is if you push them this way, you'll increase the surface area on that side. Do you agree? If you increase the surface area, what happens is more potassium channels are open. More permeability of potassium, more potassium can flow in. Now this is important because the liquid that makes up this area is called the endolymph. And the endolymph is different than normal extracellular fluid. Endolymph actually has a high concentration of potassium, which is different because normally extracellular fluid has very low potassium. The high potassium here is almost equal to what's inside, and therefore the potential for it to go inside is very high. And so therefore when it enters the cell, it'll actually depolarize the cell. So when you push the hair cells down, potassium enters because the permeability of it becomes higher. And when potassium enters, it makes the potential above liminal. So it becomes liminal, so it can fire. And then firing will happen in the spiral, like ganglion area here. So that the nerve, the cochlear nerve, will happen in there. Okay. So this is a transducer. The nerve is a two transducer pathway. Remember the two cell pathway, the two cell sensory. That's what it is. So this is the sensation, and then the synapse, and the action potential will happen here. Okay. Propagation theory. Okay, place theory. I think that probably got written up. Place theory. So different parts of the basal membrane respond to different frequency. At the beginning, you'll have higher frequency responding to it. At the end, so at the up the helicotrema, you'll have the lower frequencies responding there. That's all you have to know for that. Second thing is that to approximate sound frequency, Jesus, what was that? That was the one where you have the action potentials equal to. You have the equation. Oh my God. Okay, so sound frequency is equal to n times action potential. Let's know that. So action potentials are actually a multiple of the sound frequency. So you hear sound frequency, you know approximately, your brain approximately knows what part of the basal membrane it was bouncing up and down at. So your brain kind of can estimate what sound frequency is, but it doesn't know exactly what sound frequency it is. But it knows the action potential frequency, right? So if you can calculate the multiple for it, if you know the multiple for it, then you can calculate exactly what sound frequency is. So he'll give you the multiple, he'll give you the action potential frequency, and he'll be like, well, which is a sound frequency? And then you'll be able to just multiply the two and just get them.
N is always a whole number. So if you ever, if you're working this out and N is like becomes 0.5 or 1.5,
you did something wrong.
Has to be wrong. Yeah.
Exactly. So always a whole number, just know that. Okay. And that's basically it for that one. Vestibular system. So this is the one that tells you how you're oriented. If you're rotating, if you're accelerating up and down. If you turn, yeah. So how it works is basically you're, imagine a glass of water. Okay. Imagine that being your saccules. So I'm doing rotation, glass of water with water inside. If I rotate the saccules, semicircular canals. Semicircular canals are rotation. So if I rotate the glass of water, the glass will rotate, but the water will stay still. Right? Because you slip underneath the water. That's what happens. Because the water's got weight, it slips underneath or slips. It stays where it is. The glass will rotate. Does that make sense? That's exactly what happens to your body. Your bone rotates, but the water stays still. So what happens with the hair cells is because they're rotating with the glass, they're rotating with. Imagine something sticking out from the glass and rotating with it. Because they're rotating with the glass, they're slipping underneath the water. The top of them, the ends that are not attached to the glass, will get pushed back. So your hair cells actually twist the opposite way if you're rotating. So if you rotate this way, your hair cells will get pushed back this way, and therefore your brain can tell which way you're rotating. So if you get rotated the other way, exact same opposite will happen. Okay? So once this happens, your immediate reflex, your fast reflex, is to turn your eyes the same way. On the other hand, though, your slow reflex, remember the vestibular reflex was to make the eyes stay focused on that one. That's the slower reflex. So what will happen is your eyes will jump back. So your eyes will rotate automatically to the right, but they will jump. Okay? So if you rotate clockwise, right nystagmus, jumping back.
With the questions like this, don't get too caught up with like, oh, he only spun for like 30 seconds. He only spun for like.
If they say like immediate spin and stop, that's the normal one. If they say continuously spinning once or twice or 3 times, then you have to like understand that what happens if you keep rotating the glass. The water eventually will start, because of friction of the glass, it will start rotating with it, right? So picture the water rotating now. Now if I stop the glass, what will happen? The hair cells on the glass will actually get pushed the same way the water is rotating, but the glass is not rotating anymore. So you stopped, but the water is rotating inside. That's exactly what happened with the endolymph. So now that they get pushed the other way, your brain thinks automatically that you must be starting to go this way. Does that make sense? If you picture the glass of water, it's very simple.
On the questions, like they said, don't get caught up on like, oh, he only turned like 2. There's no like really like cutoff for it. Like if he says he's been turning for a while, or he's been turning for like whatever, like just don't overthink it.
For my bank? It's in the second pocket. My computer's gonna die. All right, that's.
In class, he said probably just one.
Yeah.
Okay, so the video's gonna start. Alright. Caloric stimulation, you run water past your ear. If it's cold, it will cause a convection to happen one way. So cold will go past here. It will cause the endolymph to sink here and rise here. So the way it's rotating inside, picture the glass of water again. So the way it's rotating, it will push the hair cells this way, so your body will think you're going the other way.
If any questions that come up like this, I would draw this out and just draw the arrows rotating, and it helps you think about it more.
Whichever way you're rotating, you have the opposite of nystagmus. Okay?
Or cows.
Sure,
cold is opposite. Warm is the same.
We do?
If you're on your back, if you're on your back.
There's not. Orbital sensation. There's different types of sensation. There's mechanical thermal nociceptors. Nociceptors are the ones that are pain induced, right? Modality depends on the plasticity. We've already done this stuff before. Let me just hit stop on this because I don't want to.
Why did we evolve to have so many pain receptors instead of pleasure? This would have been nice.
Protection.
Yeah,
exactly. You gotta know if you're in danger, and you have pain, right? That's why people with defects in pain receptors and people who can't feel pain, they usually die by their youth, right? Okay. So know that C fibers, you have a lot of them because this is multimodal. C fibers are multimodal. Okay, and these are some of the main points. A beta is going to be fastest, and then middle and slowest. C fibers are slow, but they're going to be multimodal. Okay, know that. And that correlates with these guys here. I think that was polyneuron or something. Okay, but this is not 2 separate fibers. This is 1 fiber together. That's the name of it. Okay, cool. Spinal trigeminal nucleus. We already talked about this. You guys know it. Okay. Pulpal innervation. Know that which one's the one that is correct, I guess. Exactly. Hydrodynamic theory. Right? Okay. So know that one for sure. Know that if he puts this on there, he's going to put all 3 options plus like all of the above or whatnot. You're going to choose hydrodynamic theory for the ones that's valid. Okay? Which one's actually true? Which one's the one that's causing the sensitization and the pain? Okay? That's going to be hydrodynamic theory. Cool? Okay. Taste and olfaction. You guys already know the anatomy of this, so we're going to skip that part.
It's true.
So the main ones that you need to know, if you remember some of the questions, some of them you were like, why the hell is he asking it this way? With like, let's say which one is the most sensitive organ or something. Come on, right? Okay. Apparently it's not taste, so know that.
Just based on the number of receptors, you got like 1,000 receptors for olfactory and only like.
Okay. I would say for taste, the main one you need to know is to differentiate between taste and smell. If you have 10 patients coming in saying that they don't have a very good taste, what is it most likely? 9 out of 10
olfactory.
Is? Exactly. Olfactory, right? Okay, perfect. And what's the difference between tasting something and actually other sensories? That the other sensory, we call it kind of volatile in the sense that they're not staying there in your body. Taste ones, we actually have to, I guess we could taste it and spit it out, but we generally put it into our body. And that's what's the difference here, okay? Main thing here, epithelial cell origin versus neuronal, Okay, this is one of the main points. For sure, you have to know that. Okay, and you do have to know what the turnover is. This turnover is talking about the whole epithelial cell that's being renewed, but how often is your taste buds, I guess your taste cells being replaced? 3 hours, okay? So know that this is different from that 3 hours. That's why when you brush your teeth and then you drink orange juice, but you drink it 3 hours later, you can taste the sweets and whatnot, right? So 3 hours versus 10 to 15 days, know that. 3 cranial nerves versus 1 cranial nerves, definitely, for sure, you have to know that, okay? Okay, we already talked about this. Okay, this is supposed to be anosmia.
I was having a bad day.
Okay. Sean made this, so you can blame him. But this is the lack of smell. A meaning lack of. You guys already know that. Agousia. But know the difference between dysgeusia and.
Yeah, it should be this again.
And hypogeusia.
Yeah, this should be this awesome. Yeah. Okay. There you go.
Yeah, you all read this last night.
Okay. So. All right, cerebral cortex and higher functions. These ones you guys already did it for the last quiz. So what we're gonna do now is gonna take a 10-minute break. You guys can grab lunch downstairs and eat. 10 minutes, 15 minutes. Basic tissues, it's mostly gonna be factual. So what we're gonna try and do is focus on concepts once again that you need to know, and then we're gonna pass through them. I know you guys have questions. I mean, if you guys are here, you can ask us while we're here, or you can keep it and then you can ask us when we do the conference later. Cool?
Okay.
All right.
Thank you for joining us, Billy, Sean, Sage.